Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Stewart, your host today. We have a great guest today. You're going to be very informed and well-educated after we are finished with this podcast. So I want to tell you just a little bit about the way that I practice right outside of Dallas, Texas, just north in a great community called Flower Mound, Texas. And I started out like any other dentist out of dental school. I progressed to cosmetic dentistry and then to TMJ dentistry. As I progressed in my education and pursuing whole body health, it became very apparent to me that there's so much connected to the mouth more than just teeth. That's why this podcast is called Health and Harmony Beyond the Teeth, because there's many things that we can do as dental medicine practitioners that can affect the health of the entire patient tremendously. So many diseases start from an impaired mouth syndrome. A good friend of mine, Dr. Felix Leal, coined that term, impaired mouth syndrome, and it is absolutely perfect. We breathe through our mouth, we eat through our mouth. If we don't breathe correctly, if we don't eat correctly, that's a huge effect on the health of our entire body. And it brings me great pleasure to introduce our next guest, Dr. Tammarie Heit. Dr. Heit practices in Edmonton, Canada, our neighbors right up to the north. And to say that she's a dentist, I think would do her a disservice. Not that there's, dentists it's a great profession. I'm in it. But Dr. Heit does so much more than dentistry, very similar to the way that we practice in our practice at the Stewart Center for Optimal Health in Flower Mound. She is a practitioner that practices dental medicine, and especially how the mouth affects the entire health of the body, not only from the teeth and the health of the teeth and the gum tissues, but the way the mouth affects airway, the way the mouth affects function of our head and neck and shoulders, and it just goes all the way down to the tip of our toes. But the head and the mouth and the jaw system have such a huge impact on the way we feel, the way we perform, our overall health. So Dr. Heit, I want to welcome you today to Health and Harmony Beyond the Teeth. I'm so excited to have you. How are things there in Canada, in Edmonton today?
Well, thank you, Hal. That's quite an introduction. It's great. It's spring, and we still have a little snow, but I'm excited because, usually this time of year I'm excited because of the football team, but COVID.
Right. So your season in football would be going on about right now, right? Or starting now.
About now. Yeah. I'd have to go and check all like you, I'm the dentist for the Edmonton Eskimos. And it's really fun. I love sports. I love baseball, football, and stuff like that. You guys won the championship a few years ago, didn't you? Yeah. And what happened was I actually have a Grey Cup ring, and I'll show you my husband. This is my husband, John, and I. There's a slide there. I gave you some slides. There we go. There we are.
I remember John.
Yeah. Now, here's a picture of my ring. And the way I got it was I did this whole health thing, starting in the mouths of these athletes. And what I did was I used a technique to make a mouth guard that gave them better balance, speed, and agility. And we even measured blood flow to their brain. And that year we won the Grey Cup. So they gave me a ring and it has my name on it and everything. So that's
amazing. So tell me a little bit about that. how in the world can a mouthpiece that affects the bite and the stability of the jaw, how does that affect overall performance of these athletes?
Well, it's not just athletes, it's all patients. And dentistry has really come a very, very far way. And dentists and medical doctors are just learning about this. And I'm going to demonstrate this to you, showing you a picture of my patient before and after treatment. Now, she's not an Edmonton Eskimo football player, but she came to me with headaches. And you can see before I treated her that her teeth were crooked, but that's because her upper jaw was too small. And you can see she has a double chin there. Now, I got to tell you, she wasn't overweight at all, but the reason she has a double chin is because her bottom jaw is behind the teeth of the top jaw, which is too small. So both jaws are too far back. So what dentistry is able to do is grow the upper jawbone. And we're just discovering that because we didn't know we could grow the upper jawbone until just recently. And you know what happened with her is she's in treatment here 18 months, but all she wanted was for her headaches to go away. And those were gone within 3 months. And the next slide, I can show you why that happened. So what we've discovered is that the teeth and the jaws are like a garage and the tongue is like a car. So, you know, if your upper jaw is too small, your bottom jaw is going to be trapped too far back and your tongue is going to go into the airway. So if we can grow that upper jawbone, we also grow the nasal airway and the bottom jaw is able to come forward. The teeth are no longer crooked because there's enough room in the jaws and the airway behind the neck opens. And then what happens after that is a person's able to sleep better. Now, the connection between pain and sleep is very, very high. And, you know, you might want to check out a book by Matt Walker called Why We Sleep. It's written for, you know, for dentists and just general public too that don't know a lot about neuroscience, but it's a great book. It's a bestseller, and how this affects REM sleep and, you know, sleep architecture. So it's good for doctors to read too. So that part of our health is what's really important.
So this is amazing. You know, I get to see this every day in my practice. I feel so blessed to be able to see this, but I love seeing these cases from you and other doctors because it just solidifies in my mind and hopefully in our viewers' minds that there's more to the mouth than just straightening teeth for a pretty smile. The young lady you showed earlier, obviously her smile looks so much better, but the reason why is because her face looks better, and her face looks better because her jaws look better. Her jaws, everything looks better when it's healthy. The healthier something is, the better it looks. And that's an amazing thing that you're doing for your patients, Tammarie, is you're improving aesthetics, but more importantly, you're giving them their life back. That lady that we just saw on the left was bound for a life of headaches, miserable, cold and flu seasons, a decreased immunological system, TMJ problems, all kinds of issues that you have helped her now avoid and helped her live and thrive in her life. And that is amazing. So are you seeing this what do you see? What do you typically see in your patients when they come in your practice? They're coming to visit you for a specific purpose, like mine do. And very rarely is it just to have some fillings done. That might be part of it, but they're coming for more than that from someone that like you that practices this kind of dentistry. So what is your typical patient? What are you seeing in your patients?
Well, you can imagine her family. You know, not only are her headaches gone, but you can see the change in her face. You know, we grew the the upper jawbone. She has cheekbones. Her teeth are straight. She got all these other effects. So essentially, other people come into my practice that want the same thing. And then they bring their children because they want to prevent it in children. So as a healthcare practitioner, what I want to know is why that happened. And so one of the reasons why a person's upper jaw is too small and their teeth are crowded could be a tongue tie. So I'll show everybody what a tongue tie looks like. And this is a kid with a tongue tie. And so the tongue is really important for the development of the upper jaw. And when the upper jaw is fully developed, there should be enough room in there to fit all the teeth so a person doesn't need braces and doesn't need their wisdom teeth out. And part of getting that is not, because there's people who don't have tongue ties but still have a small upper jaw. But like you already said, Hal, that, having a healthy diet of hard foods that you eat, and Felix Leo's books is another book you should read just to get overall health. But the way it can impact people is profound. And I'm going to show you a video of a young girl who couldn't talk. And she was already 8 years old. And the medical doctor didn't know what to do, so he sent her to a speech and language pathologist. And she tried everything, and she couldn't get this child to talk. And so she sent her to me because I take care of a lot of tongue ties, because you just release them, and that helps the upper jaw grow. And it's a very simple procedure for a dentist to do, and it has a very powerful effect. I can play that video for you now if you like.
Yeah, that would be great. Let's watch it.
Her shiners have definitely improved, and snoring at night and breathing through her mouth has gone away. Her speech improved tremendously with the help of opening her palate. Her tongue could go where it had to, and yeah, we've seen big improvements.
Oh, you could take off your glasses.
My risers were very nice, and I like how it blends in with the white and blue.
Oh, really? Do you want to show everybody what they look like? Open really big.
So when I came home with my blue risers, my teacher was like, Ava, spit out that gum. But I told her it wasn't gum, it's risers.
Big improvement. We couldn't understand, only 60% of what she was saying, and a stranger can only understand about 20% of what she was saying, and now everybody can understand her.
So y'all could see
Wow. Wow. So
the dark circles under her eyes are still there, but she can talk.
Right. She's headed in the right direction.
Yeah.
So how do you do something like that, Tammarie? How do you treat a patient like that without going into great detail, but we don't have time for that, but.
Well, you know what? Dentists now have a lot of technology that we never had before. And I know you have this cone beam technology in your clinic. So let's just show a picture of what dentists can see now that they never used to be able to see. So you can't diagnose what you can't see. So we can do an X-ray like this that has very low radiation compared to other X-rays. And we can compare that to the face. And as you see, there's an animation there that shows, the airway in the neck. In this particular case, red and black is like a bad airway. And we can actually measure that airway and put a number to it in a volumetric sort of sense. And we can compare it before and after treatment. So what we found out with people like the patient we just showed you is that their airway really increased quite a bit. And how does that impact, medically your child? I can show you the next slide. If you start scanning all your patients and you say, well, look at the example in the third column there, that's a child with Asperger's syndrome. Now you just saw that red and black is bad. That airway is terrible on that child. So we have the ability now to do sleep studies on children, and many of these children have sleep apnea, when a person stops breathing at night. And the impact of that, again, read Matt Walker's book. that the impact of that is huge on all body systems. In dentistry, we're able to do sleep studies on children, and this is just something that's hot off the press.
So very interesting. As someone who prescribes sleep studies regularly, I know that technology for being able to have a sleep study for a child is available now. Tell me a little bit about that.
Okay, well, I'll show you a 10-year-old boy here. And here we are just trying to grow his face, which we're doing. But now we can measure not only, using the X-ray machine, the amount of bone growth he has, but we can see that his lips are able to close now because his teeth are changing, his face is changing, and we can measure the sleep study. So you can see there on the left, before we treated him, he stopped breathing 16 times an hour, which is very severe for a child. And the image on the right shows that same child a year later, and it's down to 0.
Wow.
And so the frustrating part is if you have the technology, it's easy to measure it. It's like, how valid is the technology, and can medical doctors use it to diagnose? So yes, it's coming out. There has to be a lot of clinical trials, but the thing is people don't want to wait with their kids for clinical trials. So the specially trained dentists that can do this, like Hal and myself and all the dentists in Vivos Therapeutics, we're able to measure these airways. And we can do it on very, very young kids. I have a picture there of a 2-year-old with, I'll show you that. See, she's got the measuring device there on her wrist and her thumb. And if you go to sleepimage.com, you can learn more about it. And I'll show you what this sleep study looks like, Hal, because this is how I explain it to my patients. So there it is. You can see the date of birth there is 2 years old. And basically, green is good, yellow is caution, red is bad. And so the first thing we're going to look at is the signal at the bottom, and we can see it's mostly green. So we have a good signal. That means we got good data measured on this child through the night. So one of the tough parts about getting sleep studies on children in the past have been that they're such restless sleepers, they throw the equipment off. And now with this, they don't really. So if we go back to that image again, we can see that sleep apnea in this child is 0. She's got 2 green bars there. But look right above that, the sleep quality is red. That it's bad. And that has resulted in sleep pathology there on the right. And those are the symptoms that, had I known about this with that first child, the one who couldn't talk, I suspect she had sleep apnea. And the treatment I did in dentistry was actually something that helped her sleep apnea. So that now we'd be able to measure it before and after. So we don't just have to show a video testimonial with no explanation. Yeah. Now we can have a diagnosis before and after treatment and what that pathology might be. And it's related to the child's chief complaint.
And I love it that we're talking about children here, because people, I think the vast majority of people think that sleep apnea is something that's associated with older people and overweight people. And you and I both know, Tammarie, that I've got so many adult sleep apneic patients that are fit, and they play these 40-year-old mothers come in, they're right off the tennis court, they're fit, they're athletic, and they're suffering because they have these small jaws and they can't breathe. So it's not an elderly disease. It's not an obesity disease. Of course, those are factors, but even children children can have sleep apnea. And those apneic events, just to expound just a little bit, when an apneic event is when someone stops breathing for 10 seconds or more during their sleep. And so the young man you showed earlier, the young child, he's doing that 16 times per hour. That's really, really rough on the body. And cumulatively over a period of years, it can actually increase your morbidity and early death and early chronic diseases. And so being able to go as close back to the cause as we can and treat it earlier, it's always a better outcome for that patient, because it's easier to treat something in its infancy than after it's been, in
Yes.
20 or 30 or 40 or 50 years old.
And you can tell in children the signs and symptoms of potential sleep apnea. It looks exactly like ADHD. Kids get hyper and they're hard to control. They don't do well in school, all those things. If you have a child that's bedwetting or anything that's not normal, right away you want to do a sleep study. Now, these sleep studies are new, and they're going through all these processes, but you want to think of the airway and the mouth. And probably the best way is look at the jaws and see if there's enough room for the teeth. So instead of thinking, sleep apnea is associated with people that are old or obese, a person could sort of think of sleep apnea as being associated with someone with small jaws. And that would be a child with crowded teeth, an adult with crowded teeth, or teeth that were extracted, those kinds of things. But children, like a little 2-year-old, would be mouth breathing all the time, maybe are a messy eater, they're posturing their jaw. Thumb suckers, those, the red light should go on with those kids. And there's ways dentistry can help with the growth and development of the child. And probably the most impactful way is in an infant. If an infant can't breastfeed, look for a tongue tie, and not just an obvious one that goes all the way to the tip, but even one kind of in the back. And you might have trouble getting a medical doctor to agree with you, or a dentist even. But if there's a tongue tie there, you find a dentist that can release it. And, I've released over 4,000 infants' tongues over the last 8 years. And those kids are showing up with better jaws. But the best part is the reason I released the tongue with my dental laser is because the mom couldn't breastfeed. And in 78% of the symptoms of lack of difficulty breastfeeding are resolved with just a simple 10-second laser procedure on the infant's tongue. So the challenge is to find a dentist or a medical doctor that can do that, or that wants to learn to do that. And you can find information on that on Dr. Kotlow's website. He's in New York. His last name is Kotlow. And he wrote a book called SOS for TOTS. SOS for TOTS.
SOS for TOTS. I love it.
Yeah, it's good.
Well, my partner, Dr. Corridor, is taking an infant release residency right now with Dr. Zaghi's group out in LA. I did the adult and child residency with him as well, and so we're going to be offering that as well. And the child that you're talking about, what a healthy mouth would look like, that parents can just look at their kids' teeth. Describe for me, Tammarie, so our audience out there, if you have, like, say, a 5 or 6 year old, what should a healthy 5 or 6 year old mouth look like?
Well, I put a photo here so that you could see it, and this might be a good opportunity for you to take out your phone and take a picture of this photo, because you have to be Dr. Mom. Not everybody's going to know to look for this. So you want your child to have spaces between all their baby teeth, top and bottom. Then you want the upper teeth to just overlap the lower teeth just a bit. So if you think of the teeth and the jaws like a garage and the tongue's like a car, you want a nice 10-foot ceiling in that garage. And, if the upper teeth completely overlap the bottom teeth, then that would be a garage with a 5-foot ceiling, and that would affect the airway. So those two things. Then you want the tongue up in the palate and the child is silent and invisible. So there's no snoring. They're breathing through their nose with the lips sealed, and the tongue is up in the roof of the mouth. And that's the perfect child, the perfect 5-year-old. And here's a photo of it. Look for that. Get your kids to do this, and take a look at it, and see if that looks like your kid. And if it doesn't, find a dentist that knows how to do this. Go to hell. You can check. And dentists can guide the child's growth. And the goal, or the gold standard in my mind, and this is not an official gold standard, but would be to grow the child's jaws so big so they don't need braces and they don't need their wisdom teeth out. So that's not the goal. It's like shooting for the moon. So if you shoot for the moon, at least you get the rocket pointed in the right direction, and you can help minimize a lot of interceptive treatment. But as a child grows, we can definitely help modify the jaws and the teeth and the airway as a dentist.
Now let's put up a slide now of a lot of the typical children that we see with the narrow jaws, the deep bite. And so that can juxtapose to what we just saw, what health was, and just describe a little bit about what we're seeing here with an impaired mouth in a youngster.
So we'll have crooked teeth, the bite is deep. You can see sometimes the tongue is tied. Sometimes it's not tied, like the video I showed you. But if a child has allergies and things like that, there's other reasons why the tongue is not up in the palate. So one of the most important things to look for is if your child is mouth breathing, and you want to get them breathing through their nose. And there's lots of doctors that can help you with that. You just have to find them.
Yeah, and I always tell my patients, if you're not sure your child's a mouth breather, just one night, on a normal night when they're sleeping, go observe them for 10 minutes, an hour, for 3 hours in a row, and videotape it, or just watch them for 10 minutes. If they're have their mouth open and you can hear labored breathing, or you can hear noisy breathing, they're a mouth breather. So a lot of parents, well, how do I know? So that you don't have to watch them all night. So 10 or 15 minutes once an hour for 3 hours in a row. That's the guideline that I give the parents in my practice.
So I have a very compelling video that describes what you said just perfectly. So I'll show you this boy who, this is what he looked like sleeping in his bed. And, his head is cocked back, his mouth is open, and he's not silent and invisible. There's snoring. You can actually witness him stop breathing. And this is, I'm going to show you one more video. And this is a mom who brought her baby in to get her baby's tongue released, but she drove 4 hours to my clinic and brought her teenage boy. And I took care of her baby, but the boy was sitting in the front room, and my team right away spotted just the development of his face. They knew how to screen for this. And so we started talking to the mom, and I was able to help the boy who didn't even come to my clinic for an appointment. And that's his story. But having a visual of what a child should look like, as opposed to what they actually look like. Snoring is not normal. It's not cute like daddy. If anybody snores, they should be checked for sleep apnea.
I came to your clinic because I had found out that Arwen was tongue-tied. She couldn't breastfeed properly, and she was very colicky.
I think after the whole tongue-tie thing, you took a look at me.
Our son was having trouble breathing at night. We went through with a consultation for a DNA appliance. He did end up having to go in for surgery for an adenoidectomy and a tonsillectomy.
Breathing became a whole lot easier. I found out that I grew 5 inches right away, just feeling a whole lot better.
You can see that a person's ability to reach their genetic potential or to optimize their growth that's meant to happen was affected by not having an optimal airway. And as soon as you open up that airway, that kid's going to shoot right up. They're just going to get better, and not just physically, but mentally, and they'll just be a healthier kid. So the mouth really is the gateway to health, and dentists that's our wheelhouse, is the mouth. And all kinds of things can happen if things aren't quite right with the mouth and the teeth.
That's exactly right, Tammarie. And wow, what great information you gave today. A lot of really, really good points that parents and or just adults for themselves can take back and think about, and maybe go get your child checked out, go get yourself checked out, because if you're not breathing right, if you're not breathing well, you're not living well. And there's so much more potential that you would have if you're breathing well and if you're not impaired through your mouth. Tammarie, I want to thank you so much. How can our viewers get a hold of you if they wanted to come and make an appointment with you there in Edmonton?
Well, it'd be fun crossing the border in the first spot.
Well, people are going to be watching this all over the world, so there'll be a lot of Canadians watching this.
Yeah, well, my practice is Avalon Dental, but there's quite a few dentists that are Vivos Integrated Dentists, and any one of those dentists can help you the same way I can. So if you go to vivoslife.com, you will find a dentist in your area. Maybe it's even your dentist. Another way to do this is get your dentist to start doing it. There's so many people that need this. There isn't enough dentists on the planet to provide the service. So what we need is more dentists actually learning how to do this. So the best thing you can do is get your own dentist involved. And then if you can't get them, then just find one that is. And, it may or may not be in your city at the moment. And basically what dentists are doing are collaborating with medicine, because this really is a dental solution to a medical problem. And medical doctors are just finding out about it. And they're really, the ones that find out about it are super excited to know what dentistry can do. And I've actually started a webinar series, so you can learn a lot more about this. I have 3 of them posted on YouTube right now. So if you go to YouTube and you just search "The Science of Sleep Apnea," you will see 3 webinars. One is with myself and a cardiologist, and how important this is for the heart. The second one is with myself and a neurologist who's also a sleep specialist. It's called Optimal Diagnosis and Treatment of Obstructive Sleep Apnea. And the third one is on pediatrics, and it's the same title, but Diagnosis and Treatment of Pediatric Sleep Apnea. And that's with a board-certified sleep specialist who's a pediatric doctor. So the collaboration between medicine and dentistry is very important. A lot of general medical doctors are learning about this, and my next podcast is going to be live on April 29th, and my guest will be a primary care physician, and he's turned into a sleep specialist, but it's kind of like the barriers medical doctors have with doing this, and we're going to try to solve those problems. But every single specialty in medicine is affected by sleep apnea, and dentists can help.
Yeah. Well, and dentistry is really leading the way on this, and I'm very, very proud and excited to be part of it. And I'm very proud to have to be able to call you a friend and a colleague. And it's just been wonderful today, Tammarie. And like we always do, we end each podcast with some music, because this is health and harmony, and music is good for the soul. So what song have you picked out for us today? It's Fire by Youth XX, right?
Yeah, I'm the fighter, I'm the ghost in the night, and I'm the bullet, I'm the flash in the fire, and I'm an ember that's about to ignite. You led me like a fusion, brought me to life, and I got something you want, got something you need, 'cause all
the significance of that song? Why you chose that song today?
Well, I was a nurse for 10 years and I've been a dentist for 25 years. I'm still a nurse and I love helping people, and it's a fire in me. And I just, on a sports note, number 42, Jackie Robinson, I love him and everything he stands for. And he said this, he said, a life is not important except in the impact it has on other lives. So you and me, Hal, that's what we do. And everybody watching this, you could be a leader and help other people learn, whether it's another patient or your dentist or medical doctor, and help this breathing wellness movement and help dentists and medical doctors learn about this and how we can make a really big impact on society.
Very well said, Tammarie. Thank you so much. It's been wonderful. We'll have you on again someday.
Okay.
So have a great rest of the day. Enjoy the spring in beautiful Edmonton, Canada. And we will see you guys next week in our next episode of Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, signing off.